Well, good afternoon, everyone. Thank you so much for taking time out from your day and spending a little time with us here at this President's Town Hall this afternoon. And I know everyone's got a lot going on, and we're going to try to provide you with as much information, or at least as much as we can, provide answers to the questions that you have at this point. I will tell at the outset, and I will say this several times throughout this town hall, that we have more questions than we do answers right now. We know that. We're going to ask that everybody please be patient with us and with our team as we work through this process. And also please know we're going to do everything we can to get you information as soon as we get it. And we're going to be using all sorts of formats in order to do that. This town hall will attempt to address the questions that we've already received. I believe we're planning another town hall for next Friday, so please look for details on that. It will be virtual and streamed, and by then I'm sure we'll have a lot more answers to questions that we have now, as well as other questions that I'm sure will come along. And then please continue to look at the Jaguar, which that's the site you hopefully have become accustomed to when you've been seeking information regarding this whole pandemic that we've been through. And we're going to use that site to continue to try to provide a landing place for you to go for information. I think as most people know by now, President Biden issued an executive order on requiring coronavirus disease 2019 vaccination for federal employees. And that's what I want to be spending the vast majority of my time on today, providing you with the details on that as best we know them and answering questions that you have. The Biden executive order requires all federal contractors, including those within the University System of Georgia, to provide written confirmation that they are fully vaccinated against COVID-19 by the date of January 4th, 2022, and to comply with CDC guidelines on masking and social distancing. In one sentence, that describes President Biden's executive order. As you can imagine, there's a heck of a lot that goes on behind that to make sure that we are abiding by this order. And I'll hopefully we'll be able to get you with some more information and details about that today. I want to say from the very beginning, this is a presidential executive order, but this is a President Biden executive order and not a President Keel executive order. This impacts virtually every university in the entire country. It certainly impacts every university within the University System of Georgia. And I, along with the other 25 presidents in this system, have been working tirelessly with our system office in Atlanta to make sure that we follow the guidance provided by the system and that there is consistency to the best we can as a system in implementing what we need to do as a campus to meet this particular guidance. So please, when you hear the words presidential executive order, this is not something that's emanating directly from Augusta University. Quite the opposite. This is something that Augusta University is doing to meet, along with all of our brother and sister institutions across the state and indeed across this country, to meet this particular executive order that has been issued by the United States President. And I want again to tell you at the outset, we have more questions than we do answers at this time. If COVID-19 has taught us anything as a university and as a community, it's the need and the absolute requirement to be flexible. COVID-19 and how we have responded to that, and incidentally, this campus has responded to it in an extraordinary way. And I really would be remiss if I didn't take just a moment to again thank all of our healthcare workers and providers and all of the staff that are at this very minute in our health system, just a short walk down the hall from here, treating patients day in and day out, and they have responded in such an incredible way, and I want to thank every single one of them. But throughout this COVID-19, we've had to be flexible. We have had to move on a dime. We have had to adjust to a changing landscape that has been dictated primarily by the disease. And we find ourselves in a situation now no different than we have before. And what that means is that we're going to have to respond to this particular challenge, just like we have with all the other challenges that this particular pandemic has presented to us. And I have great faith and great confidence that you will join with me in exercising that utmost patience for this situation we are in and for our fellow workers as we work through this. So please be patient with us and please stay informed. This is an incredibly rapidly moving landscape that we're navigating. And as I've said now many times, there's going to be a lot of changes yet to come, and we will deal with them as they come along, and we'll support each other in that process. So let me go into some of the aspects about this, and then answer some of the questions that we've already received regarding the implementation of this executive order. As of the 4th of November, yesterday, there were 5,177 AU employees that will be required to document vaccination. That's 84% of our workforce. From what we have been told and what we have gathered, that percentage is approximately what the other Research One universities in the state have been dealing with. Some less, some more, depending on their specific circumstance. But these individuals have been identified by virtue of the fact that they either have a federal contract or are associated with that particular contract. So this number is specific to our campus, and the 84% of our workforce number is specific to our campus. Now, I will tell you, as we can continue to do an exhaustive review of our contracts and of the buildings in which these contracts are implemented, there may very well be more employees identified. And again, it just speaks to this need that everybody needs to be patient and stay tuned. So far, we've identified 55 buildings across the entire Augusta University campus that are impacted by this order. And again, as we continue in the exhaustive review, there may very well be more buildings that are identified and therefore more employees that are identified. But as of yesterday, and for what I'm told, as of this afternoon, in fact, 5,177 employees, or approximately 84% of our workforce in the university side of the house is going to be impacted by this. And I'm going to just jump ahead and be very clear that this is what we're talking about here are the university employees. Now, as you all know, we have been blessed to be a part and the only campus in the university system that has as its part and has as its very DNA a medical school and academic medical center. And we have always said that not only will they probably have different rules, they will have different rules for how to deal with COVID-19, how to deal with this particular mandate. So please stay tuned. More information is coming regarding the health system and what potential impacts there may be. And we will certainly keep you informed along those lines as well. Who is impacted by this? All full-time or part-time employees, including student workers working on or in conjunction with a covered federal contract. Employees who perform support functions such as human resources, billing, legal review, and other roles are impacted by this executive order. Employees who are in the same workplace as other employees working on or in support of federal contracts, but do not themselves work directly on or in conjunction with a federal contract are impacted by this order. Now, on the one hand, that's very plain and simple. On the other hand, that's also very complicated. And we have been working diligently to make sure that we identify the right people, the proper people, and let them know that they have been identified. Those employees on the university side who are impacted by this should have received an email yesterday that looks very similar to the one you see on this slide. And I've excerpted a small portion of that says the employees in your division have been identified as falling into one of the categories for which vaccination is required. As such, employees in this area will be expected to submit confirmation of their current vaccination status and to be fully vaccinated against COVID-19 in compliance with the executive order's deadline of January 4th, 2022. Now, you may have heard, if you've been keeping up on this, there was an earlier deadline that was sent out. That has now changed. The deadline for which we have to have everyone vaccinated is by January 4th, 2022. And I'm told that of the 5,177 employees, the majority, if not all of them, have been contacted, or their divisions have been contacted in which they work to let them know that they fall into this category. What does it take to be considered fully vaccinated? This has also changed during the past week. And as it is right now, to be considered fully vaccinated, you must have 2 doses of the Pfizer or Moderna vaccine or 1 dose of the Johnson & Johnson vaccine by January 4th, 2022. If you've received mixed doses of Pfizer and Moderna, you're also considered fully vaccinated. And at this point in time, boosters are not required, are not part of this this mandate, this requirement. So if you are taking the Pfizer or Moderna vaccines, you have to have your 2nd dose by January 4th. Or if you're taking the Johnson & Johnson vaccine, you have to be vaccinated by that single dose by January 4th, 2022. We are utilizing a software called Qualtrics, which allows us to input all of the data, and our folks have done an incredible job of identifying these over 5,000 individuals placed into this software package that will allow us to contact those individuals and allow those individuals to upload the required documentation. Please stay tuned for instructions on how to do that. If you have been identified as someone who needs to get vaccinated, we strongly encourage you to go ahead and get vaccinated. You will be given documentation at the time, and stay tuned as to how you will upload this documentation through this system, which will be managed by HR, so we can verify your vaccination status. Will the institution be honoring employee requests for religious and medical exemptions? There are 3 exemptions that are associated with this requirement. One is for religious, sincerely held religious belief, and the other is for medical or ADA accommodations. Each request that we receive from employees will be reviewed individually as required by law, and a fact-based decision will be provided for each request. Excuse me. Religious exemptions must be based on a sincerely held religious belief, and prior vaccinations for other purposes may be considered in this evaluation. Medical or disability accommodations must be supported by a physician or healthcare provider determination and will be considered individually through an iterative process with the employee. So yes, there are exemptions. They are very limited, and you will be receiving information shortly about how to apply for one of those exemptions if you believe you have a sincerely held religious belief, or if you believe you have a medical or accommodation or medical reason for not receiving the vaccine. Again, please stay tuned for more details about how to do that. Will we be notifying individuals individually? Impacted employees should have received the email guidance I showed you yesterday. Student workers are also required to comply, but it's student workers, those students that are employed here on this campus, are required to follow this executive order, not students in general. So the students in your classroom, if they are not student workers, are not required to follow this executive order. You probably have seen that in the mandate, companies with greater than 100 employees who choose not to get vaccinated must be tested for COVID once a week. Will there be an option on our campus? In other words, can you choose to be tested once a week instead of getting the vaccine if you fall into one of these categories? And the answer is we just don't know yet. That has not been determined. We, again, are working very closely with our system office to get guidance on this. And as soon as that determination is made, then we'll get the information out to you with also instructions as to how to go about this. As it is right now, that exemption is not in place. Will antigen tests be administered for those wishing to be considered exempt from vaccine? Which, along the same question, if I have had COVID vaccine and I've recovered and I have antibodies, does that mean I do not have to get vaccinated? And the answer is yes, you still have to get vaccinated. Antigen tests or natural immunity are not acceptable in lieu of vaccination. Is everyone at AU required to be vaccinated? No. Some employees are not included in the vaccine requirement. Those that are have been identified by email. As you remember at the outset of this town hall, 84% of our employees at AU have been identified as needing the vaccine, but it's not 100%. This is not an across-the-board mandate for all AU employees. It covers a lot, there's no doubt, but it is not an across-the-board mandate. And we have gone to extraordinary means to identify to the person who meets the criteria for this requirement. Does this requirement apply to research grants? As you know, this requirement applies to federal contracts. There's a very precise definition as to what that is. As it is right now, grants do not fall under this criteria. I have a feeling that will change over the coming days to weeks, so please stay tuned. The NSF has already made some indication that they would require their grants to be covered. The NIH has not. I fully expect there will be changes in that. So if you have a grant, an NIH grant to do research, and it's not considered a federal contract, as of today, you do not meet this criteria, but that could very well change and very likely will change. So please stay tuned for that. And this determination will be made in conjunction with AU Legal, in conjunction with the System Office, and also the Office of Research for any contracts that might be exempt, either now or down the road. What happens to employees who are not fully vaccinated by the deadline? In other words, if employees refuse to be vaccinated and do not have a medical or religious exemption, we're going to work with each individual to help guide them through a compliance for this mandate. Failure to comply with the directive in the absence of an exemption or an accommodation may be grounds for progressive workplace discipline per our usual HR workforce rules. This is not an option. This is a requirement. Unless you have a religious or medical exemption, and there are processes that you must go through to be granted that religious or medical exemption. Well, unvaccinated employees have to wear an identifying marker that tells everyone that they are vaccinated. No, employees do not need to share their vaccination status, and managers should not ask employees about their vaccination status. The documentation, the written documentation is going to be required, will be centrally managed through HR, through this Qualtrics software package, as I mentioned. And we will document the compliance through that particular process. We're not going to have vaccine passports that you have to display to get in buildings and that sort of thing here at this time, and I don't foresee that occurring. Will the new lawsuits affect the vaccine requirement? You probably have heard that Governor Kemp, in conjunction with a number of other states, have filed lawsuit seeking an injunction against the requirements for this vaccine mandate. We are awaiting additional information and guidance from the university system to understand if and or how the lawsuit will impact the federal guidance. The lawsuit has been filed. But we have not received guidance from the USG as to what impact that will have on us, plus or minus. So again, it's one of those questions we just don't have an answer for at this time. Please stand by. What about future hires? Are they going to be required to have this screening or receive the vaccine during the initial employee health screening? Our HR department will include the federal COVID-19 guidance in all job descriptions for those impacted positions. Again, this is not across the board for every person and every position, although it is broad. HR will, for those positions that do fall into this new hires, they will also be required to go through this process. What about unvaccinated employees? Will they continue to be harassed or segregated by those that are vaccinated? And I sincerely hope that we don't have to address this issue. All employees, regardless of their vaccination status, should be treated with respect and follow our values of collegiality, compassion, inclusivity, and integrity. Just because we have a presidential executive order we have to abide by does not mean we lose our values. We want to treat everyone with respect and compassion in everything that we do regardless. And this is certainly no different than anything else we would do. Does AU's health insurance cover injuries that are a result of receiving the COVID-19 vaccine? Yes, a coverage is available via existing employer benefits. Can I take leave in order if I get vaccinated? You may recall that Human Resources sent an announcement out on August 27th this year that said that employees may utilize up to 8 hours of administrative leave. The intent was to provide leave for employees to get vaccinated, to take time away from work to get vaccinated. That leave is still available to all of our employees. Leave can be taken in less than a full day, or in other words, increments of not less than 1 hour or a total of an 8-hour allotment. The leave that is not taken by December 31st, that's just a couple months away. Actually, it's less than a couple months, isn't it? If you don't take this leave by December 31st, it will be lost and will not roll over to the next year or any other time for future use. So please take advantage of this leave if you have not already. If you have any questions, contact your supervisor or contact the HR department directly, and they'll be glad to help you with this. What about the mask and social distancing requirements? As some of you probably know, in addition to this executive order, in addition to requiring that individuals that have been identified become vaccinated by COVID-19, there are also requirements that the CDC guidance regarding the wearing of masks and social distancing also be followed. We are continuing to review the order and should have more guidance forthcoming. So we just don't have the answers to that question yet. We are focused almost entirely at this point on the vaccine part because of this timeline we have to have everyone vaccinated by January 4th. Once we get that worked out, we will certainly pay attention to what requirements there are for mask wearing. Until that point, we strongly encourage everyone to wear a mask when you're indoors, whether you're vaccinated or not. That is what we're recommending. If we have requirements that come from that because of this executive order, we will let you know as soon as possible. I know that this raises a lot of questions, as I said. It does for me, and I'm sure it does for you. Please stay tuned. What about the health system? The health system has now received notice of additional federal orders that have been very recently issued. I believe they were issued yesterday or a latter part of this week from Center for Medicare and Medicaid Services and OSHA that may very well impact health system employees. The health system will be issuing its own communications to its employees with further information on those orders. I anticipate that this announcement will be forthcoming imminently. I suspect, if not today, certainly early next week. At least that's what we hope. Again, we're working with the system office to determine what this guidance is, and the health system is working closely with the system office as well as the Georgia Hospital Association to determine how best to implement whatever requirements come down the road. So as it is right now, everything that I have said applies to just Augusta University employees and student workers. It does not apply to the health system. We don't yet know if there will be requirements for the health system and what those requirements will be. I am really hoping, and I know that our administrative staff and health system is also hoping, that we'll get complete guidance on that very soon. And as soon as we do, we will send notice out to our colleagues in the health system. So please, again, stand by for more information. We have a website, as I hope that you know by now, that's focused on COVID-19, and it has been the source of all information from the university and the health system as well. We're continuing to use that website, and I thank our DCM folks for putting this together. The link to the website is shown down below. It's www.augusta.edu/covid-resources/executive-order.php. Please go to the COVID-19 website. Just do a search on that for Augusta University. It'll take you to the website, and you'll be able to get on the COVID-19 vaccine guidance for federal contractors. You'll find a decision tree there that we've been using to determine who is an employee that is impacted by this. You'll find the latest information. As soon as we get it, will be posted there. You can also send an email to our HR at wearehr, that's WEARE, HR@augusta.edu if you have questions and they'll get an answer for you just as quickly as we possibly can. The questions that I have gone over so far were generated from that particular email address, and our HR folks are working with DCM to be sure that as we get ready for the town hall next Friday, that we also formulate answers to those questions. We have a frequently asked question, a fact site there as well, and as each questions come up, we will place answers on that particular site as well. So please go to this website. If you have specific questions and you don't see an answer there, reach out to your supervisor, reach out to HR, to HR, the Augusta.edu website, and we'll do our very best to get you answers that you need. This has been a Herculean effort. Even in the face of all the things that we have gone through as a university during this last, 21 months throughout this pandemic, all of you have come together in an extraordinary manner and have done things that can only be described as Herculean. I want to send a special thanks to the transition team, co-chaired by Drs. Russell Keene and Neil McKinnon, who have spent an extraordinary amount of time trying to get information together so we can implement this order. There were 4 teams that were put in place: a decision tree team, a documentation team, a communication strategy team, and an exemptions team. I've listed those teams. The members in red are the chair or co-chairs of those particular teams. They have been working literally around the clock, literally throughout 7 days all this week, to try to make sure we get information out to you. And they will continue to work, just as they have through the entire pandemic, to better position us to answer your questions. I want to thank every single one of them for the extraordinary amount of work that they have done to try to provide us as a campus with the information that we need. Thank you. I want to finish by just giving you a couple data shots on where we are as a health system in terms of COVID-19. We've used this data extensively throughout this pandemic so that we can also make decisions on our campus. This plot shows you in green the daily COVID positivity rate throughout the beginning of this pandemic, going back to March of 20. You see there are 4 waves. And the last 3 waves of this have been particularly hard on this health system. But the good news is the positivity rate is coming down. It is at 5% or less now. The black dots are the 7-day rolling average, which really sort of smooths out some of the noise there. So the good news is the positivity rate for our community is declining and is remaining low. In terms of the number of patients that we have in the hospital, you can see these 4 peaks, 4 primary peaks here, especially the 3 larger ones. We have been dropping precipitously in terms of the number of COVID-19 patients we have in our health system. And we are down now less than 30, where I believe is what the data shows there, roughly around 30 or so for the 7-day rolling average. And as you can see, that is continuing downward. That is certainly good news. I will tell you that we have been, throughout this last wave of the pandemic, since the vaccine has been available, 95% or more of the patients that that have COVID-19 and are in our hospital have been unvaccinated. 95% or more of COVID-19 patients in our hospital are unvaccinated. The vaccine works, the vaccine is safe, and the vaccine is what's going to get us out of this COVID nightmare that we are in. So we strongly encourage everyone to get vaccinated. And we ask that all of you, whether you're vaccinated or not, to please work with us as we work through this pandemic and as we work through this particular presidential executive order. One last thing to show you are the actual number of students and faculty staff on the university side. This goes back to a fall semester 2020. The blue bars are the number of faculty and staff, and the green bars are the number of students. We report this on a weekly basis. I shoot a very informal video that provides narrative on this data. The data are published on that COVID-19 website I talked about. And we have done that now since the onset of this vaccine. I've recorded my 47th video, I believe it was, just this past week. And we're going to continue throughout COVID-19 to use that as yet another mechanism to get you information you need regarding COVID-19 and how we're dealing with it. Again, as you'll see on the far right of that graph, the number of cases that we're seeing among our students and faculty and staff is very low in the single digits, and we're certainly very pleased about that. Is normal life ahead? That's the ultimate question I wish I could answer for you. And I don't have the answer for that. None of us do. But as I've said at the outset, this campus has impressed me, this university and this health system has impressed me so much with how we have all come together and without question the most extraordinary times that any of us have ever lived through. And I don't think there's anyone can doubt that. And yet we've done it with grace, we've done it with style, we've done it keeping in mind that our number one priority is our students and our patients, and will continue to be that way as we move ahead. We are not out of the woods yet. We just aren't. And I know you're tired. I know you're fed up with COVID-19. I certainly am. You can bet our healthcare providers sure are tired of all this. But as a family, we'll continue to get through this. And I can't thank you enough for all that you do. I'm going to end this town hall here at this point with a thank you. And again, I ask you to please stay tuned. We will be sending information as soon as we get it. I promise you we will. We're planning another town hall for next Friday as we accumulate more questions and as we get more guidance and as more stuff happens with regards to this particular requirement. We will get information to you. So I ask you to please stay tuned. Tune in for the next town hall. You'll be receiving information campus-wide about that. And again, thank you for all you do, and go Jags.